Good afternoon, everyone. As a preliminary matter, this is Stephen Vigent, Chair. Please permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Jenny Fishman?
Affirmative.
Dr. George Abraham?
Present.
Staff, when I call your name, please respond in the affirmative. Kerry Stockwell?
Affirmative.
Anticipated speakers from the CMRPHA, Julie Van Arsdalen, probably not here just yet. Micah Blondeau,
Affirmative.
Sherry Tangri,
Affirmative.
Cassandra Anderson,
Affirmative.
Jennifer Nakajoba,
I don't think she's joining us.
oh, okay. DJ Wilson,
Here.
Missy Hollenbach,
Here.
okay, and Brian Moss.
Here.
Okay, good afternoon. This open meeting of the Board of Health is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. The order allows public bodies to meet entirely remotely, so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. For this meeting, the Board of Health is convening by Google Meet, as posted on the town's website, identifying how the public may join. Please be sure to press *6 to mute your device. This meeting will not feature public comment. Please wait until I open the item for public comment and press *6 to unmute your device. Finally, each vote taken in the meeting will be conducted by roll call vote. Okay, the next meeting of the Board of Health will be held on Thursday, May 13th, 2021 at 4 p.m. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 20A, Section 18, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Shrewsbury Board of Health will be conducted via remote participation to the greatest extent possible. To participate in the public comment portion of this public meeting, please dial 1-617-675-4444 and enter the following PIN, 788-962-807-7838#. Please mute your device until the chair of the board addresses this agenda item or opens the meeting to public comment. I will now call the meeting to order. The first item on the agenda is review and approval of minutes from the April 30th, 2021 Board of Health meeting. Do I have a motion to approve?
Motion to approve, Mr. Chair.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham.
Aye.
Jenny Fishman.
Aye.
Steve Vigent, aye. The meeting minutes are approved. The next item is to review and act on a request to present Article 36 to the Board of Health, requested by Brian Moss, 16 Ruthven Circle, Shrewsbury. Brian?
Great. I think, can I, Diane, you're presenting. Can I? She's got her screen up, so I'm just sorry. I'm just waiting for her screen to come down.
Okay.
Oh, I'm sorry. I'll come over here. Hold on just a second.
Let's see if I can override. No, I can't. Oh, maybe I can. Okay. So I just hit the start button. So thank you very much for giving me the 5 minutes to present to the board. Can everybody see my presentation?
Yes, I can.
Okay, great. I wanted to thank the Board of Health and the chair for giving me the opportunity to speak. Since last we met, I did present a lot of information, so I'm not going to repeat much of it. I'm going to cover some new stuff and just focus in on some feedback that I've gotten from some of the other boards. So we do have last we talked, I presented the information, and I did submit a citizens petition. And the citizens petition is very laser focused. It's specifically opposing the addition of fluoride in order to stop exposing vulnerable subpopulations, such as pregnant women, to fluoridated water due to an unreasonable risk. That's important because it's a risk. It doesn't have to be causation or proof of harm, right? It has to be a risk versus a proof of safety is a higher bar. And also without any benefit to the child's teeth, because I think a lot of people don't want to weigh that risk reward. And I provided information to show that there isn't any benefit to the child's teeth when pregnant women drink the water, per the CDC. I'm going to skip around my presentation a little bit. So a lot of I heard about, I've been some of the, from some of the town, either board members or town meeting members, have been saying I've been cherry picking the studies, but I wanted to say that since 2016, there have been 4 NIH-funded Merck element birth cohort studies that have shown an association between fluoride and this is systematic, right? The drinking of fluoridated water or ingesting fluoride, not the topical use. And I'm going to say it's not me that's cherry picking. This is actual court document from the lawsuit, which is this is the court saying this, right? So in particular, the studies arising out of the Merck element birth cohorts were all published after the EPA had denied plaintiff's petition, and this lawsuit had already been filed. Importantly, even APA acknowledges that these studies are the highest quality, most reliable studies to date on the subject, and the judge cites these different things where even it's in stipulated fact where the EPA agrees. There's a disposition of EPA scientists saying that agreeing that epidemiological studies emerging from the element cohort were very well conducted, and agreeing that Dr. Lamphere, which I want you to remember that name, is an important lead person who has done very important and reliable research. And down at the bottom here, Dr. Chang for the EPA saying identifying the Bahash green and till studies as the most rigorous from a methodological standpoint. So I just wanted to focus in on that. It's not just me cherry picking. I'm going to go down to number 14. So that's the risk of harm, right? So what EPA is saying is the best studies on neurodevelopment impact of fluoride, all showing an association. So, but if you go to this, say, well, what's the proof of safety? And I know the Board of Health instructed me to go off and find that. And what I did is I did find it in the court documents where you have the CDC under oath saying that it doesn't have any data on the tolerable upper fluoride intake for neurotoxic effect on children. That means they do not know the safe level. So that you cannot say it is safe for this specific subpopulation. So a lot of times people say, well, it's safe and effective, but you can't just take that broad brush and put it across everybody now, because the CDC has admitted under oath they have no safety data for the neurotoxic effects on children. I wanted to show some of the new things too. There was the Board of Selectmen had asked about the fluoride status in the towns. So the green is not fluoridated. So you can see like Worcester is not fluoridated. All these green towns around us do not add fluoride. That's about 70, I'll say 3/4 of the population does not drink fluoride in its water in our area. We are of the minority of 25% of these towns, population wise. And you also have, just in our Central Mass Health Alliance, I just did a little thing here too that says 81% of the population in our health alliance do not drink fluoridated water, and only Shrewsbury and Holden population do, which is 20%. Then there was some challenge on the effect on the IQ, saying, well, wouldn't we notice it? We would notice the effect of IQ. 5 IQ points, I look around and I don't notice a difference, but that is because you won't see a difference. And here is the distribution, and why I said to mention Lamphere is because he's the one that did this video, which I've sourced here, that shows you that a 5-point IQ drop results in a 57% increase in the number of children that are challenged from 6 million to 9.4 million, and a 60% decrease in the number of children that are gifted from 6 million to 2.4 million. And my time is up, but I just wanted to say that what the vote means. So if I can have just in a second to show that. If you vote yes, then you're helping to stop exposing the vulnerable subpopulation, which is pregnant women and their fetus, right? We're stopping exposing them. But if you vote no, you are voting to continue the 70-year experiment on vulnerable subpopulations and continue to expose pregnant women and their fetus to fluoridated water, given the unreasonable risk to the child's brain, which I showed you with those EPA best studies, with no benefit to the teeth, which the CDC says under oath. So I just wanted to say what that vote means. Thank you. And thanks for the extra time.
Well, thank you, Brian. Appreciate that and keeping for your time. Are there any questions specifically for Brian from the board?
Yes. Are you able to share this presentation with us, Brian?
Yes, definitely. And also I have, each thing is cited. So for all of the quotes and everything, each thing is now has a link where you can actually, if you see any of the depositions, you can watch the video where I've got the different pictures selected out in the presentation. You go actually watch the video of them doing that, as well as any of the court documents I reference in here, which there's a great one, which is the summary, which contained that it pretty much summarizes a 2-week trial, where the judge summarizes it and cites it. So you can see where they're citing that the EPA agrees that these studies are the best studies on neurodevelopment, and that they are showing a risk, of neurotoxicity. So all of that is now cited in the presentation.
And one follow-up, do you know how much the town spends on fluoride per year and where we source it from?
Yeah, so we at the Finance Committee had asked this question. It was a good question for Finance Committee to ask, because I know we're under this big budget crisis. We spend about approximately $10,000 a year on fluoride. The budget number is a little bit higher, but it's around 10,000, maybe a little less. The source, which I had confirmed with the town, is from China. We did confirm, I did have them actually confirm with the source where it is coming from, because it has been said in the past that it does not come from the phosphate fertilizer industry. However, they have confirmed that it does originate from the phosphate fertilizer industry in China. And they gave a trail of information. I do have that email as well, that email trail that shows you where it's coming from and how it's made in the different factories in China. And that it does come from the byproduct of the phosphate fertilizer industry in China.
Thank you.
Okay. Dr. Abraham, do you have any questions?
No questions, Mr. Chair. I'd also like to review the information presented.
Okay. Unless there are any other questions, I think we need to take a roll call vote. As Brian said, a yes vote would recommend to town meeting the passage of Article 36. A no vote does not recommend the article. So I'll take a roll call vote. Dr. Abraham?
Motion to defer so we can review the documentation provided.
Well, the only thing here is that we're doing this today mainly because we're trying to whether or not to recommend the article at town meeting, which is May 22nd.
Oh, I see. Okay. Then I'm going to say no.
Okay, Jenny Fishman?
I vote yay.
Steve Vision, I vote no, so the motion does not pass. So Article 36 is not recommended by the board. Thank you, Brian.
Thank you very much.
Okay, the next item on the agenda is review and discuss climate and health crisis requested by Melissa Hollenbach, Shrewsbury resident.
Okay, so I will be presenting. Can you see the slide?
Yes, I can.
Okay, very good. Thank you. And I have 5 minutes?
Yes.
Okay. Hi, my name is Diane Jones. I moved to Shrewsbury in 1989 with my husband, who was born and raised here and taught in the Shrewsbury school system for over 30 years. Both our kids grew up here in a nice, affordable 3-bedroom ranch from the early 50s. And since 1993, I have been licensed by the Massachusetts Board of Medicine to practice acupuncture. And I love to garden. I am that lady who stands out at the corner of 140 and Main Street every Friday for the past 21 months, holding signs for climate action. People honk, smile, wave, give us a thumbs up all the time. It's a lot of folks. A group of concerned Shrewsbury residents has coalesced, and we have submitted a petition requesting the town of Shrewsbury to declare a climate and ecological emergency. 19 other Massachusetts municipalities have already done this. More are pending. Worcester passed a similar declaration in 2018. It's time. I grew up in a medical family. My father's specialty was preventative medicine, and the lessons I learned from him are the same lessons that apply directly. How do we see and respond to the climate and ecological emergency we have created by ignoring the effects of burning fossil fuels? We have not been proactive in preventing the climate crisis, and it's getting worse. This is settled science. There are things we can no longer prevent. We just have to work with them. And other things, we have to do everything we can to make sure they don't happen. We have to reach net zero emissions as fast as possible. For the sake of public health, the more we say this out loud and the more we educate our citizens, the better chance we have of preventing absolute climate catastrophe in our lifetimes. There is, I'm sorry, let me get over here. A social cost to carbon, a social cost to burning fossil fuels. Air pollution caused by the burning of fossil fuels such as coal and oil was responsible for more than 8.7 million deaths globally in 2018, a staggering 1 in 5 of all people who died that year. More than 68,000 people died prematurely in the US from air pollution in 2018. And in the past 2 decades, heat has killed twice as many older people as the 2005 baseline, reaching a record high of 19,000 deaths in 2018. Let's look at children. Rising temperatures and decreased air quality affects kids by increasing asthma attacks and allergies, worsening pregnancy outcomes, creating food insecurity, increasing mental health problems, developmental delays, and changes in their genetic makeup. Air pollution accounts for 20% of newborn deaths worldwide, most related to complications of low birth weight and preterm birth. All right, climate change produces hotter temperatures and worse air pollution, and that matters to a child's brain. Some studies have shown that heat and air pollution can influence everything from how a brain develops to how well a student does on a test. This is from the Chan School of Public Health. A study in Massachusetts found that children living within 50 meters of a major roadway where particle pollution is higher due to car traffic had lower IQs and poorer ability to do tasks that require hand-eye coordination than children living more than 200 meters away. And consider all the people in Shrewsbury who live, work, go to school within 50 meters of Main Street, Route 9, 140, 290, 20, and their connecting streets. I'm going to skip over a couple of these slides. The American Heart Association and the American Lung Association have joined the Medical Society Consortium on Climate and Health. Excuse me. As always, the most vulnerable are at the highest risk: the young, the old, pregnant women, poor people, people of color, people on the margin for all sorts of reasons, including being LGBTQ. Violence is on the increase with rising temperatures and decreasing resources. 3 years ago, Shrewsbury signed on with the Municipality Vulnerability Preparedness Program, which is good for preventing floods, setting up a crisis center, securing hazardous materials in an extreme weather event. And there are also things it is not designed to do, which is why we need to declare a climate and ecological emergency by saying out loud the raw basic fact that fossil fuel emissions are hitting the earth much more quickly than climate scientists predicted, by acknowledging that unless we change direction now during this decade, we face climate catastrophe in our lifetimes. By declaring that, we take the first step towards making appropriate decisions for our future here at a local level. People typically resist change, but in this case, change is being forced on us because we are not adapting our policies and behavior in step with climate reality. And this is what good leadership is for. The town has a role to educate its citizens. That has huge value in and of itself. Good leaders foresee future problems. They make goals, work on them. When possible, they prevent the preventable, and they prepare for needs they cannot prevent. It's humane, good fiscal policy, it's good public health policy, and endorsing our petition costs nothing. We are asking the Board of Health to endorse Article 34 and help us declare a climate and ecological emergency. Thank you. Thank you very much. That concludes this presentation, and Rachel Missel is here to help me with any questions you may have.
Okay, thank you very much, Diane. I really appreciate that. And are there any questions from the board?
Mr. Chair, so first, I want to say that as chair of the Board of Registration Medicine that licenses Ms. Jones, but I have no conflict of interest because I do not know Ms. Jones personally. And so my question is, what specifically is the ask in Article 34 that we are being asked to support?
You want me to take that, Diane?
Yeah, go ahead.
Okay. So what we're asking is, first of all, to commit to getting to net zero as soon as is reasonably and fiscally possible. And also to notify the governor's office that Shrewsbury has declared a climate emergency. This is the equivalent of making a pledge. It doesn't cost anything. There's no metrics that have to be met by a specific time, but it brings to mind the awareness, the need to make sure that we're taking this into consideration with all of our decisions that impact the climate, and trying to move Shrewsbury forward, hopefully faster than what's been recommended at the state and federal levels, because that's too late.
Mr. Chair, I just have a follow-up comment, then I'll keep quiet. I know Ms. Fishman has a question. So I'm just concerned about use of the term emergency. I completely understand the effects of climate change, and that's well documented. There is an abundance of scientific literature around the health effects of climate change. And so I get that completely supportive. It's just when we use the term an emergency, indicate something with a very immediate time effect, which we all understand that there is an urgency to it, but not necessarily an emergency. So I just have trouble supporting the term emergency. I completely supported the concept of climate change and its impact on health.
May I respond to that?
Sure, go ahead.
Just very briefly. Sorry, now I forgot what I was going to say. Essentially, what we're asking, though, is that the town of Shrewsbury tell the truth. And the truth is that the globe is in an emergency. So to call it urgent is perhaps understating the reality of the situation.
Jenny Fishman, do you have any questions or comments?
Well, I did want to respond to that. I would have to agree with Rachel about that. I feel like an urgency was 10, 15, 20 years ago. We are at a point now that I think our decisions going forward need to have that as a priority. As an example, it's always boggled my mind why Beale doesn't have photovoltaics on the roof and why that wasn't part of the plan. You know, simple things like that I think we have to declare an emergency because it's not being prioritized the way it should be.
May I speak up?
Sure, go ahead.
Okay. I'm going to quote from the American Lung Association. They put out a declaration on climate change and health, and it's been signed on by 31 different health organizations. As leading public health, environmental health, patient advocacy, healthcare, nursing, and medical organizations, we declare climate change a health emergency and call for immediate action to protect the public's health from the current and future impacts of climate change. And if I might add, the carbon in our atmosphere lasts from anywhere from 300 years to 1,000 years. And so every day that we add more, it's cumulative. It is not something that tapers off if we stop. It's going to still be there for hundreds of years, if not quite a bit longer. So actually, it's an emergency in that we have to prevent the worst from happening.
Ms. Hollenbach, would you like to speak?
Yes, please. Sorry, I'll lower my hand. The other thing is that, particularly from the Board of Health and the Department of Health, constantly, particularly through the summer months, we get notices from you, thankfully, letting us know about Triple E, letting us know about West Nile virus, letting us know about heat waves. We let us know about E. coli in water. The beaches are closed, that we need to open cooling stations for people, particularly in the winter months, we get this. Then we also have, the hurricanes and all that type of thing. The town has signed on for the MVP program, which kind of plans for, emergencies, how we can set up those cooling stations, that type of thing. By declaring an emergency, it almost in some ways helps the Board of Health, because when you have these announcements, that you're also getting a chance to remind people and let them know that this is all collectively part of a health emergency issue. And that is something that I think in some ways it kind of helps you a little bit as well. So thank you.
Thank you. For me personally, I think one issue I have is that I'm not sure that this is necessarily a local Board of Health issue, that it falls under the purview of a local Board of Health. I understand obviously understand the issue, and that's not really it for me. It has more to do with, is this part of the core mission of a local Board of Health? And I also wanted to kind of agree with Dr. Abraham that the word emergency is a little difficult for me. Maybe I'm too much of a literalist, that it's something that you can basically address right now in terms of making it go away. So that was my only take on the issue. Okay, if there's nothing else, I think what we
May I ask one
go ahead,
question?
Dr. Abraham, yes.
So would the sponsors of this request be amenable to some sort of a word change? I'm completely supportive of their sentiment. I do recognize the underlying issues completely. I just want to balance so that it's more broad-based and does cater to the larger, broader swath of population that we would want to touch, which I believe the sponsors also want to touch, and as you alluded to, Mr. Chair. So just a change in verbiage maybe, but still support the sentiment. I just don't want to throw the baby out with the bathwater.
Well, I think the way town meeting works is that we have a warrant article that has that terminology, unless the proponents were willing to make a change at town meeting.
Got it. Thank you, Mr. Chair.
So, sorry.
I just wanted to kind of respond, Chairman, to you in terms of where the role of the local Board of Health. I mean, I think this does fall under public health, which is sort of our, field, and we are the sort of guardians of our community and what is in their best interest.
Well, thank you, Jenny, and I really do appreciate all of these opinions. It's just something that I think it's not in the same realm as, say, COVID-19 or Triple E or the food safety and all those things in terms of having immediate effect. But in any event, I think what we need to do, unless there's any other comment, we need to make a motion to recommend. It's Article 34 of the town meeting warrant. A yes vote would recommend Article 34. A no vote would not recommend Article 34. Do I have a motion to approve Article 34?
I motion to approve Article 34.
I'll second it.
Okay. We'll take a roll call vote. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Steve Vigent? No. So the motion passes by a vote of 2-1. So I will make a point of communicating this result at the town meeting on May 22nd.
Thank you, Mr. Chair.
Very good. Thank you.
Thank you.
Thank you.
Thank you all.
Thank you very much.
Before we move on, I'm not 100% sure that I made a motion in regard to Article 36, the fluoride question. I just want to go back and revisit that. Do I have a motion to recommend Article 36 of the town meeting warrant?
I motion Article 36 to approve.
So I think we need a second to be able to vote on it, correct?
Yes, that's correct.
Okay. I'll second it.
Okay, so we'll take another roll call vote now that we have a motion, seconded motion. Dr. Abraham.
Nay.
Jenny Fishman.
Yay.
Steve Vigent, no. Okay. So
We did have a motion to look at that, but that's fine. I'll just double check and go back and put Jenny that's making the motion.
I was just wanted to be sure. I guess I was having a senior moment. I didn't remember if I did or not. So.
That's okay. It's always best to double check.
No,
I still blame everything on COVID.
I think we took a vote, but we probably didn't make the motion. So I think this way we can combine the two. So since Ms. Fishman made the motion is always to be in the affirmative. So I think we did it correctly this time. So I think this is appropriate.
Duly noted. Thank you all.
Thank you, everyone. Okay, the next item is to review and act on the possibility of incorporating new changes from the state tobacco regulation into the Shrewsbury tobacco regulation. Okay, so at our last meeting, we had a presentation by Cherry and I think DJ Wilson in regard to possible additional updates or changes to the Shrewsbury tobacco regulations. DJ came up with 5 items for our consideration. Maybe we should just go through each one briefly to see if there's any interest in addressing these. The first one has to do with changing the cap on the tobacco retailers in the town of Shrewsbury. It's currently 27, and we actually have 19 retailers in town. Is there any desire to lower the cap? Or at least address it at a public hearing?
So you said the limit, we currently have 19 and the limit is 27?
27, yeah. I'm not sure what that does other than reduce the workload for the Alliance instead of in case more people come in.
I would be interested to hear if there are recommendations to lower it. What is it? The, let's see here. Is there sort of a consensus across the state, depending on town size?
Either Cherry or DJ, do you have any thoughts on what the what is the upside to doing something like this?
So the way, there is no consensus statewide. There's no formula that we give out. But generally, most cities and towns that have a cap either go with the number of retailers that they currently have, number of retailers plus 1, or number of retailers plus 2. And so what ends up happening is just that there's, at the time that a city or town puts the cap into place, you may have been at the height of, you may have at the time had pharmacies able to sell tobacco. You may have had a number of vape shops that were entrepreneurial and think that they were going to make it big in the vape world and didn't, and so they halted and closed. And so you're not uncommon that we have some early adopters kind of have a high cap, and then the low cap, the actual numbers way down here. So the reason for doing so, the public health rationale is just that fewer places means fewer places for kids to get tobacco, fewer places that need to be monitored, and also, there are studies out there that indicate more places that have cigarette and tobacco and vape advertising does insidiously get into the brains of minors. So that would be the reason that we've had cities and towns revisit their cap, is just get a little closer to what they are actually at.
Okay. And for the time being, we're not really making any decisions here. It's just whether or not the board is interested in revisiting the regulations with these items at a public hearing, and we can discuss that more at the public hearing. So I guess, I mean, I don't have a problem addressing this. If we're going to address any of the other items, I would be in favor of at least talking about it at a public hearing.
So Chair, is the ask to vote as to whether or not to bring this to a public hearing?
Yeah, it's not so much a vote as to whether or not the board has interest in conducting a public hearing to address more items on the tobacco regulations. So it's just getting a sense of what the board might like to do.
I mean, I could see lowering it to, what is it, 19 plus 1, so 20?
Mm-hmm. So yeah, and I think when we go down the line here, I think there may be some that we may want to make the effort to have another public hearing to address. So you might as well throw this one in there to consider, in my opinion.
I'm supportive of that, Mr. Chair.
Okay, so let's move on to the second one, which is there's a new policy chart that would basically better define which fines are state or local. That's a very nice specific chart from studying it, and I think that's another one that we might want to throw into a public hearing.
And
looks like everybody's in agreement on that one.
Agree.
I would agree too.
And I'll provide an updated policy chart before any hearing takes place, as we've already added one to the left column.
Okay. The next one is whether or not to actually ban smoking bars, cigar bars, hookah bars, vape bars in the town. Again, you don't have to debate that now. Just do we want to throw that onto a public hearing agenda?
I would be.
Do we actually have any in Shrewsbury?
No.
Carrie?
No, we do not, but
No.
I can tell you that it is often an inquiry about hookah bars, but because of the upfront costs, and of course, Sherry could speak to that better than myself, or Cassandra or DJ, they usually don't come to fruition, but it definitely is something that is asked quite frequently.
Yeah, I think that was something that I would like to hear more about. So, putting it on the agenda for a public hearing, I think might be useful.
Agreed.
Okay. Also, number 4, it's an amendment to the flavor policy, and I guess it's kind of a little better definition of what constitutes a violation of the flavored ban in town. And I guess DJ, I guess you say that this is something that's other towns, cities have been doing.
Yes, we are now recommending it because the state law allowed for retailers to sell through the internet to out-of-state customers flavored products that they otherwise cannot sell in their store. But what we're finding is practically they'd have no market to do so because we're an expensive state for both the product and the taxes that go on these products. So what we were finding across the state in those jurisdictions that were responding to complaints from complaints from citizens or retailers, and our people would go in and do the inspection, is that they were, keeping prohibited product on the premises and basically selling it to customers they know, which they weren't supposed to do. And so, we've had certainly a number. We oddly enough have had a few anecdotal stories where the inspector, like Sherry's counterparts around the state, were standing there when it took place, an illegal sale sales transaction. So we thought this is one way to actually say, as a retailer, you're more than welcome to, have a internet sales setup, but it can't be inside the retail store that is permitted by the town.
Yeah, if I could just comment on that, how that plays out is that if Cherry goes in and does an inspection and finds the product, and then she writes a ticket, and the retailer says, I'm not going to pay this ticket. I want to take this to court. When we go to court, the retailer says, oh, that product wasn't for sale in the store. That's one of my internet sale products. I don't really sell that. And then it becomes extremely difficult for us to actually enforce the regulation. So it is, I think, very important for this, because like he's saying, we get reports, maybe not from a particular store at this moment in Shrewsbury, but we get calls all the time at our office from citizens saying this store is selling these products to people, and my kid, family member, whatever, and then we go down and we have to then in the court hearing try to convince the judge that they're actually selling the product, and the store will say, oh, I don't really sell that product. I just had it there, but I'm not selling it. So it is. Yeah,
just interesting to broaden the issue a little further. So we've always had an issue that when we send in a trained youth to do a compliance check, we know that that girl or boy is going to be a stranger to that store owner. And so we actually set up for an artificial compliance check, because most kids would go back to the same store that keeps on selling to them. They become a regular customer. Same thing is happening here with the prohibited product with adults. So we've had a couple instances where we have learned from a competitor, usually. we've learned the code to use when you walk in the store. So we've been able to send in an adult in a compliance check, because you don't need to be a youth to try this out, and the adult uses the code and gets the prohibited product. So.
Okay, well, it definitely sounds like it's something worthwhile addressing in an agenda, public meeting agenda. So I think we can move forward to the last item, which is to dealing with rolling papers and flavored rolling papers. And again, it's one of these things where I think it's worth, since it looks like we're planning on having another public hearing on tobacco regulation, it's worth hearing more about and discussing. Everybody agrees? Okay.
Agree.
Okay.
Okay, so unless there are any other questions, I think we can move on. We'll just have to, when we get to the reviewing our meeting schedule, we can talk about what's a good time to schedule a public hearing to go along with a meeting on tobacco regulations. So with that, I will move on to the next item on the agenda, which is review and discuss coronavirus COVID-19 update.
Thank you very much.
Thank you. Thank you, DJ.
Thank you, DJ.
Have a good night.
Me too.
Do we have Julie?
She's actually not able to talk right now, so she just asked me to bring up a few points on coronavirus at the moment. So one of the main items right now is that they have now a surplus of vaccines and are looking for more arms to put the vaccine in. The other points would be that the COVID numbers are going down and have been staying down so far, which is very promising, but just looking to get past all the people who have some hesitancy about taking the vaccine or just are procrastinating getting it. We've also had a big drop off in the number of COVID related complaints, and such as masking or social distancing.
Okay, thank you. Thank you, Micah. Dr. Abraham, do you have anything to add or would like to comment on?
No, nothing further, Mr. Chair. Thank you.
Okay, obviously things are getting much better. The vaccine is readily available, even walk-ins, and even for now, I guess, children as young as age 12. So it's all coming around, and the reopening of the state is occurring, and looks like we're on a good track. So it's good news. Okay, the next item on the agenda is to review and act on the report from the Central Massachusetts Regional Public Health Alliance. And I guess that's you, Micah.
That is me as well. Yep. Since the last meeting, I did a total of 23 inspections. Most of those are routine food inspections. Only one complaint, and just a few housing inspections as well. So I've been increasing the frequency that I've been going through a lot of these places as all these new coronavirus standards change. So I'm trying to get out there as much as possible and keep everyone up to speed on all the changes and make sure people are staying vigilant. We're also getting ready for our pool season. We have camps coming up. We have an RNA inspection coming up. So there's a lot coming up, temporary events. So it's going to be a busy summer.
And I guess the farmer's market is going to start up in June then, right?
That's correct.
Very good. Any other questions from the board?
Nope, not at this time.
Okay.
Thank you.
Okay. Hearing none, I guess we will move on to review our meeting schedule. I guess the first question I have is when to schedule a public hearing on tobacco, modifying the tobacco regulations. And I know we would have to come up with an agenda and some, speaking terms, so to speak. And I'm not sure if we should do it for the next meeting or probably the meeting after. And Carrie, you need some lead time, right, to publish in the newspaper?
Yes, that's correct.
Would you feel more comfortable with the meeting after next?
Yes, I think that would be very helpful. Thank you.
Agree.
Okay, so we will address the tobacco regulation public hearing at our next regular meeting. So for our next regular meeting, again, we have Carrie on vacation for, I think, all of the Fridays in June, correct, Carrie?
Yes. Yep. Have to finish them out.
Okay. So does another Thursday at 4 work for the other board members?
Depending on the Thursday, I think I can do the second and fourth Thursday of the month.
Okay. So the 24th?
I'm not available on the 24th. I'm sorry. I'm available
Okay.
on the 10th. The second Thursday I can do. Can't do the 4th.
Okay. So not Jenny. You can't do the 17th, right?
No, I have a work conflict.
Okay. So maybe June 1st?
June 1st is a Tuesday.
Oh,
Did you mean June 3rd?
I'm sorry. I mean July 1st.
July 1st. Okay, I can do it.
Yes, that works.
Thursday.
Wait, that's the first Thursday of the month.
It's the first Thursday. It's July 1st. Yep. First
Right.
Thursday.
So I need this. I can do the second or the fourth Thursday of the month because I have a standing meeting the first and third Thursday of the month.
Okay. So July 8th. How's July 8th?
If we can do 4 to 5 so that we end by 5, I can do it.
Okay, I think we can do that. I know
I'm not
it's
taking any time in July, so if you wanted to go back to a Friday morning, that's fine too. Just throwing it out there.
Oh, okay. So you could do July 2nd, Carrie?
Yes, I can.
How about the other board members?
I can do it.
Yes.
Okay, so if you want to go back to Friday morning at 8, July 2nd, that would be fine.
That works with me.
Okay. Very good. So let's plan on that unless something else comes up.
Yeah, agree.
Okay, very good. So unless there are any other
Okay,
questions, comments, do I have a motion to adjourn?
so moved.
I second.
We'll take a roll call vote. Dr. Abraham,
Aye.
Jenny Fishman,
Aye.
Steve Vigent, aye. Meeting's now adjourned. Thank you all for coming. Really appreciate your time this afternoon.
Thanks.
Thank you.
Yes, thank you all.
Have a great weekend. It's supposed to be beautiful.
It is. It
Awesome.
should be.
Thank you.
Thank you.
Thank you.
Thank you.